Hello, how are you doing today? I am Dr. Rohit Chakor. I am an orthopedician practicing in Pune since last 7 years. I have my own clinic, the Bone and Joint Clinic at Pune, Fatima Nagar. So today we would like to discuss with you about minimally invasive hip replacement surgery. Okay? So what do you mean by minimally invasive hip replacement? Total hip replacement, also known as total hip arthroplasty, is a common procedure in orthopedic population, and as the population ages it is expected to become even more common. So replacing the hip joint with an artificial prosthesis or implant relieves the pain, improves the mobility, and you are able to resume your normal daily activities after the surgery. So traditional surgical approach includes a single long incision and access to the hip joint. A variation of this is the minimally invasive hip replacement surgery, where the incision is small, the stay in the hospital is less, as well as the physical rehabilitation is early. So goal of using shorter incision is to reduce pain and speed the recovery. Unlike traditional total hip replacement, the minimally invasive technique is not suitable for all the patients. So we would like to describe how things are done in the total hip arthroplasty or replacement. So during any hip replacement surgery, the damaged bone of hip joint is removed along with some soft tissues. In minimally invasive surgery, the amount of tissues removed is less and the surgical incision is smaller, and fewer muscles around the hip are cut or detached. Despite this difference, however, both total hip replacement traditionally done and minimally invasive technique is technically demanding, and both have better outcomes if the surgeons are and the operating team are considering having considerable experience. So concept of minimally invasive hip replacement surgery is not just for the smaller incision, but it also restores the abductor muscle function which is required for normal day-to-day activities. So we are not cutting the abductor muscles. Due to small cosmetic incision, the intraoperative blood loss during the surgery is less, so less post-operative pain and quick recovery, as well as fast early rehabilitation. But this doesn't mean that visualization of the surgical field should be compromised in expense for the minimal invasive approach. So it should not affect the optimal placement of the implant and prosthesis. To perform the traditional hip replacement surgery, we take a long single 12 to 15 centimeter incision on the lateral aspect or the outer aspect of the hip, where then we detach some muscles or just retract some muscles to see the hip joint. Once we see the hip joint, we remove the damaged femoral bone along with the head and neck, and then replace the femoral stem. So this is the stem which we implant in the femoral canal in the center. After this, the damaged cartilage of the acetabulum or the socket is removed and replaced with a metal socket. So this is the metal socket which we can use. It can be having some flanges, or it can have some coating which is called as hydroxyapatite coating. So in this case, we can use both of the acetabulum, and then we can use a ceramic or a metal head. So in this case we have a metal head which fits into the stem, and then we have the complete implant which is the hip joint, which has a complete mobility when patient can walk normally. In minimally invasive hip replacement surgery, the implant and prosthesis remains the same, whereas the incision is less. It is around 5 centimeter incision to 7 centimeter incision. The implants are placed in a similar fashion as traditional hip replacement, but the approach is less, so special type of instruments are used for that, and it would be very great because the incision is less and patient is able to do his activities earlier than the traditional hip replacement. So what are the advantages of minimally invasive hip replacement surgery over the traditional hip replacement? So first thing is the smaller incision. So the length of the stay in minimal invasive surgery is less than the traditional hip replacement surgery, which is ranging from 1 to 4 days. The critical component of any surgery is the physical rehabilitation and post-op rehabilitation. So in this case, because of less pain, less amount of muscle cut, the patient is getting early rehabilitation and early restoration of function of the muscles. So he can get back to his normal daily activities early. The physical therapist and the surgeon has a team which decide upon which exercises are to be told according to the patient. In conclusion, total hip arthroplasty can be done either in traditional way or minimally invasive way. Minimal invasive being the future ahead. So I hope that you all have understood everything about the minimally invasive hip replacement surgery. If you have any queries, you can contact me on Lybrate on by my name, which is Dr. Rohit Chakor. Thank you.